Hi, my name is Cecil Baumann, and I'm your host and the founder of the company Ganz in Bewegung. I'm a movement and Alexander technique specialist. My business serves holistic thinking people who want to improve their mind-body connection. Our interview session today is with Dr. Anikó Ball, the founder of Optimum Dental Posture. We are so excited to have her here, but before I bring her up, I want to share what I mean by mind-body connection. The Ganz in Bewegung system we developed includes 7 defining components of being human. For non-German speakers, the meaning of Ganz in Bewegung is the whole of you in motion, which includes your movement, your body, your surrounding, your experience, your emotion, your thinking, and it's all connected with your breathing. And all is interconnected with each other. Welcome to our interview with Dr. Anikó Ball, the inspiring founder of Optimal Dental Posture. A graduate of Melbourne University, Dr. Ball has extensive experience in various areas of dentistry, including general practice and dental sleep medicine. However, her journey took a pivotal turn when she faced chronic pain and discomfort as a dentist, a struggle that nearly forced her into early retirement. Through her discovery of the inner ergonomic principles of the Alexander technique, Dr. Ball transformed her approach to posture and work habits, reclaiming her passion for dentistry. Now she dedicates her life to helping fellow dental professionals avoid the same suffering she endured. Dr. Ball's commitment extends beyond individual practice. She has presented at numerous Australian and New Zealand Dental Association congresses, conferences, and CPD courses, and she has been involved in a research project at Melbourne University Dental School aimed at improving the physical and mental well-being of oral health students. Her vision is clear. She advocates for the inclusion of ergonomic and wellness in dentistry training programs at all dental schools as a preventive measure against musculoskeletal disorders. Dr. Ball has trained a dedicated team in Switzerland to launch workshops aimed at educating dentists and their teams about ergonomic practices that enhance well-being and productivity. Her mission extends beyond just relief. She advocates for incorporating ergonomics into dental education to foster a healthier future for the profession. Join us as we delve into Dr. Anikó Ball's remarkable transformation from a suffering dentist to an enthusiastic leader in dental ergonomics, allowing her to share her story and vision for a healthier dental community. Welcome, Anikó. How are you? I'm so
I
glad
am
you are here
well.
today.
Hello, Cecile. I'm delighted to be talking with you.
Anikó, can you share with us the story behind your passion for dental ergonomics and how you founded Optimal Dental Posture? What motivated you to focus specifically on this area of dental practice?
Well, I can tell you that I had been suffering neck, back, shoulder pain and eventually pain in my hips from the time that I was a dental student and then decades into practicing. I went everywhere for help. Every physical therapist I could find, medical specialists. I had every type of test, and nobody looked at what I was actually doing with my body. All I received was symptom relief. It wasn't until I came across the inner ergonomic principles of the Alexander technique that I finally understood why I had been in pain and how I can help myself. And the interest in ergonomics came from the fact that I knew that I could help my colleagues, and that's why I decided to participate in a 1,600-hour in-person training in Melbourne at the Melbourne Alexander School over 4 years, and spent thousands of hours translating that into dental-specific application. But I remember that before I came across the Alexander work, I called my dental association in Melbourne and asked for an ergonomic specialist and a work health safety expert to come out to the practice where I was working and to see why I was in pain. And this expert looked at everything that was around me, but didn't look at what I was doing. And so years later, when I was doing my Alexander training and thinking how I could take this to my profession, I realized that dental ergonomics is a massive field of research and development in dentistry, but it's all about what I call now the outer ergonomics, everything that is not the professional, everything around me. And then I realized that what I'm going to be teaching is what I call the inner ergonomics, what you're doing inside yourself, the way and the how you do what you do. And this is what really propelled me and motivated me to specialize in this area. And I know that if someone like me would have met a younger version of me and taught what I'm now teaching, I wouldn't have been suffering for so long.
Oh, yes, yes. This would be wonderful if this is better known. Also, all around the world, not only Australia and New Zealand, but in the whole world. It's really necessary because many dental professionals experience physical discomfort due to their work posture. Can you elaborate on the common postural issues faced by dentists and dental assistants and dental hygienists? How
And
do
hygienic.
these issues impact their daily work on overall well-being? Because we are not all dentists, so this could be very interesting for other having issues.
Absolutely. And I would imagine that every workplace, every profession has its unique challenges. What happens in dentistry is that, first of all, it is not taught in dental school that when you're holding postures, you can't do just anything with your body. And I remember that I thought I could twist myself any which way and do whatever I needed to do with my shoulders and arms, and it would be okay. Well, it's not. So the challenge for dentists is that when I talk about dentists, I include dental hygienists as well, is that we need to look into the patient's mouth, and the patient's mouth is down there. And then we have to get our pair of hands holding instruments into the mouth. And often we have to do that for a long time because there is a lot of treatment time involved in the average appointment. And what dentists tend to do is to twist to their dominant side, bend forward to the side. Usually the non-dominant shoulder is up and elbow is up. And at times the workspace is quite tight. There's not a lot of room to move. And of course, the dental assistants are doing the opposite on the other side, twisting and bending as they hold the suction and trying to see into the mouth and assisting the dentist. So everybody is finding these challenges enormous. So it's a combination of physical challenges as well as there is stressful time pressure challenges because they have to run on time, they have to manage a whole host of issues within the appointment. And also another layer, Cecile, that is, I would say, almost unique to dentistry is that most patients come in for their dental appointment feeling quite anxious and frightened. Some will cover it up with a layer of hostility, and others might admit that they're feeling uptight, and that is infectious. The team, the dentist and the dental assistant pick it up.
Yeah, yeah, that's true. I don't know many people who like to go to the dentist, and I'm honest. But since I know you, I really enjoy my stay at the dentist because it's interesting to observe how they work, what they struggle with, and it's much more. I'm much more aware how I, as a patient, can be turning my head and twisting and helping the dental hygienist to work on me because this is really something I always tell now. Please tell me how I should look, and I do my best to support that they are not struggling so much. Probably, hopefully. So
Well,
why
you
do you?
sound like the ideal patient.
Oh yeah, I try to be, since I know how much pain they are suffering, and it's really it's a hard job. It's not so easy, and we forget when we go to the dentist.
Most patients are not aware what is
Yes.
happening to the dentist or the dental assistant. And also, dentists need to carry out very complex, high precision work on a moving target. And
Yes.
that with tongue and lips and saliva. So I won't go into the detail, but it's a very tough profession.
Yeah, it's really, and it's also small, and if you also work with children or elderly people who probably can't move so well anymore. I mean, there are so many things, but let's continue with the questions I prepared. So, why do you believe ergonomics is crucial in the dental field? Can you explain how proper posture can enhance not only a dentist's health, but also their performance and patient care?
The best way to start, first of all, is that rather than calling it proper posture, I like to talk about working with your design.
Mhm.
Once I learned that you can't do just anything when you're holding postures, it's different to when you're moving. When you're dancing, you can do lots of things, twist and bend, because you keep coming back to neutral. But in dentistry, where we hold work postures for long periods, patient after patient, then it is important, and that is the foundation to my teaching. Is I teach how we are designed to hold postures. Some joints are designed for prolonged bending and some are not. Some muscles are designed for prolonged contraction and some are not for static holding. And so once people learn that, then they're going to be a lot more comfortable, because when we're in pain, and I'm sure everyone, dental or non-dental person, can remember that when they're uncomfortable, it's hard to pay attention. I know when I was in pain for decades, I lost my sense of humor. I was not as creative as I can be. It impacted on me on so many ways. I still looked after my patients, but I was very uncomfortable, and it has to compromise everything.
Yes, yes. And also the private life gets somehow
Very much.
lost because when you're in pain, you need a lot of recovery afterwards and you have to, yeah, somehow. Could you describe the key principles and methodologies that Optimal Dental Posture employs in helping dental professionals? What unique strategies do you use to address these postural challenges?
Well, the first thing I like to do is to explain the fact that when we do something over and over that our body was not designed to do when holding posture, so repeating that activity, then there is trauma at a microscopic level, at a cellular level, and it's cumulative trauma. So I explained that. So my participants in my courses and workshops understand that there is a reason why they're in pain. Because for all the years that I was in pain, until I came across the Alexander work, I thought it was just my bad luck. Must be my genetics, or I don't know what I was doing. And so it's really helpful for people to understand that it is something they're doing, but it's not their fault, because no one ever taught them that they can't do certain things. And I teach functional anatomy. In dentistry, we learn descriptive anatomy, but we don't learn where the important joints are and what those joints can do. For example, the spinal joints below the height of the ear are gliding joints. They're not designed for repeated or prolonged twisting and bending, which dentists tend to do, and hygienists over patients. And also learning that the muscles that move the shoulder, arm, and hand are movement muscles designed for a quick movement, not for prolonged contraction. So teaching some of these things and then practicing the application of these principles around the dental chair and also in daily life, because what I find is that whatever is being done in the clinic, to some degree, that same harmful posture is being done away from the clinic. And so I teach both. And unless people start observing what they're doing, which I call postural awareness, tuning in even for a moment, how am I sitting? How am I doing whatever I'm doing? Away from the clinic, it is almost impossible to do the same in the clinic. It needs to become second nature. So this is some of my foundational methodology, teaching what people need to know about their bodies. And it's not a lot, and it's not rocket science. It's quite simple. It's just overlooked everywhere. And the importance of observing oneself, being aware of what we're doing. Because I remember before I came across all this work and started practicing this way myself, I felt like I was a disembodied pair of eyes, brain, and hands, and the rest was a black hole.
Yeah, that's interesting. In the Western world, I think there are a lot of brains and eyes and hands are running around without their bodies.
Yes.
Not only dentists. Ah, because I remember I was the same. Because even though I'm a dancer and I trained a lot in dance, I got disconnected from my body because it was hurting all the time. So you somehow dislocate, or you don't want to feel the pain. So you don't feel it anymore after a while if you always disconnect. So this getting connected again, mind-body connection, it was the key for me. And I think you tell now the same story just for dentists. It's
Oh,
interesting.
absolutely. Cecile, it was like there was a brick wall between my head and the rest of me.
Trying to do what you have to do. Yes. You offer various training programs and workshops for dentists and their teams. What can participants expect from these sessions, and how do they contribute to creating a healthier work environment?
Well, I run a variety of programs. The most immersive program is a 2-day workshop, 2 consecutive days, where there is theoretical learning and then lots and lots of practical application and training one-on-one and in small groups. And people walk away with a surprising amount of awareness. It's almost like the penny drops about what they need to know, but they never learned. And I do wish that we learned all that in dental schools, or dental nurses learned when they were training. And then I offer shorter courses depending on how much time people can put into training. Last week I went out to a very large dental practice with an assistant Alexander teacher who is a trained Optimum Dental Posture trainer. And we trained the dentist, the hygienist, the oral health therapist, the nurses, the receptionist, everyone in their workplaces, and they couldn't thank us enough. They realized we teach people how to recognize harmful habitual work postures. I never call it bad posture or good posture. I talk about what is harmful and leads to cumulative trauma and what is okay. You're not doing anything that's harmful. So people, participants in any of the courses, any of the programs, walk away with a lot of practical knowledge, awareness, tips, techniques. In fact, what surprises me the most, Cecile, is that I've delivered 45-minute talks, presentations at dental conventions and various events where I wouldn't expect in 45 minutes that people can take away a lot. And I've had a number of dentists email me afterwards telling me that just from that short presentation, and I try to demonstrate as much as possible as I talk and show slides, they walked away knowing how to do a few things different. One of them said that her back pain improved already. I was delighted and surprised.
Yeah, I mean, I went to the dental hygienist this last week on Friday, and she told me that her dentist now has a refractive loop, and she was so irritated because he was staring at her, right, like this. And she was like, "What are you doing? You have to look down to your patient." Why do you stare at me? And he said, "Yeah, no, I have this new loop to save my neck." And I was like, "Oh, Wow, that's great. So the awareness is slowly seeking or sneaking into dentistry. Your work you do is so powerful that people really can catch it up and they start to save their necks and backs, and just because they now know what's harmful and what's disturbing their posture and their work. It's fantastic. So in your and also one thing I just realized is that you also guide kinesthetically. So the kinesthetic guidance is also an important role, isn't it? When you give two
Absolutely.
days workshops, because the habit
Yes.
is strong.
Well, I explain. So my talking is speaking to the people's thinking and awareness. And I ask permission if it's okay to place my hands on their shoulders, same for my assistants or the head, just to guide people into what is a posture and movement pattern that works with their design and is not harmful. And that allows people to run optimal neuromuscular firing pathways and also have a muscle memory.
Mhm.
And also, as you know, we teach directional thinking. So I tell people to think, because dentists and hygienists and nurses are always lifting their shoulders. So we teach them to not do that and to think of sending the shoulder away from the other shoulder, and placing the hands there teaches them what we mean by that. So there is a lot of kinesthetic guidance, one-on-one training within small groups, which helps people. However, I teach so that people can do it for themselves. Often people say, can you please come around and spend a week at my place and keep reminding me whenever I'm going back to my old habit and place your hands on me? And I say, well, I'd love to, but I can't.
Yeah, this would be a lot of work, but I understand because the habit is so fast and you really need to train the neuromuscular system in a new way so that it's there when you need it, and really to untrain the old habit. It's quite a process, but it's fun also. Once you know how to save yourself, it's really fun work to do. In your experience, how does improving posture among dental practitioners affect their productivity and job satisfaction? Are there any statistics or case studies that highlight these benefits?
Well, there is actually a study. It doesn't give statistics, but it does talk about the fact. So this was a study that was done over 4 continents and published in 2020. And I can give you the link, and you might like to include it at the bottom of the interview.
Mhm.
What they found this was a systematic review on prevention of musculoskeletal diseases among dental professionals. And they found that when people are in pain, there's a growing inability to work, poorer work quality, decreased job satisfaction, more accidents. There was a long list of what happens when dentists are in pain.
Each dentist has unique needs based on their working environment and individual habits. How do you customize your recommendations to cater to different practitioner situations?
When dentists come into my workshop, I ask them to show me how they work. And then, by the way, you'd be amazed how similar most problems are. It's almost like cookie cutter um, situation. However, there are some slight differences, and I always cater for the differences. When I go out to a dental practice, I have a long conversation with the practice manager. I ask for photos beforehand. When dentists reach out to me individually, I ask for photos of them taken in front, on the side, and I get a sense of what they're doing, and I tailor specifically to what they're doing, but it's almost always very similar to what everyone else is doing.
Yeah. And still, it's different from the side or assistant and dentist, the side difference, and you also work in teams. You know, if this is a good thing to do, the dentist and the assistant together to see what kind of challenges they have and how they can support each other, isn't it?
Oh, very much so. I find that when a team trains together, they can support each other in habit change. Because the trouble is, as you know, once we've done something a few times, we have a software in our brain for that particular habit. And it feels so comfy and familiar that we don't know and we don't notice when we slip back into it. So if I'm teaching a dentist, for example, not to twist to the side, then they learn not to do that. However, for quite some time, the habit is so strong that without realizing, the dentist will be back doing that. So I train the dental assistant who can see the dentist. And I say, now, anytime the dentist comes up to vertical, just wave to him and they have to agree on some kind of signaling. And every time you break a harmful habit, that habit gets weaker. Same with the dental assistant. The dental assistant tends to do this on the other side. So she or he, mostly it's a she, either needs to come back to the vertical, or I teach them to stand in a lunge so that they can see into the mouth and not twist their spine. The burnout rate among dental assistants is very high. And in fact, there is now a worldwide shortage of dental assistants.
Yeah, that's not a good sign. It really
No.
needs to change. So, what are some common obstacles that dental professionals face when trying to adopt better posture practices? How do you advise them to overcome these challenges? Also, this is one, one, but you have more, I know.
Well, the hardest thing is that when there is complex treatment to be done, there's time pressure because there is appointment after appointment. It is very difficult for dentists and dental assistants to pay attention to themselves. And this is why I stress the importance of learning to become aware posturally away from the clinic in their daily life and break habits. For example, bending down to the mobile phone, that's a very harmful habit, and that also contributes the amount of neck and back pain they experience. So learning to bring the phone to the face rather than take the head down away from the clinic is essential. And I actually say to the participants in my training programs, unless you can do that away from the clinic, there's no way you can begin to make changes to harmful work posture habits in the clinic. So there are a lot more challenges in the clinic. And I think the key is to start postural awareness and habit change away from the clinic. And then it becomes easier to break those habits in the clinic. Team training together is a great idea.
Hmm. And what I remember you told us was also that if you have this refractive loop where you can look in front and see down, you advised to read a book with those loops before going to the patient, so just to get this new habit to stay upright and look down. And I
Yes,
love this example that it's really from the daily life. We train in daily life where there is no time pressure, nothing else you have to be aware of, just to be aware of yourself and probably a book or something to train beforehand. And that's such a clever way. I love it.
well, this is just to get used to the idea after
Mm-hmm.
years or decades of looking down. It feels so strange to look ahead. However, I have to tell you, Cecile, that now many dentists are working with these refractive loops, which are like a mini microscope. And guess what? They are still doing this and that because instead of moving their stool around into different o'clock positions or asking the patient to turn, or chin up, chin down, they are twisting their spine. So the refractive loops have helped to some degree, but the old habit, unless they have trained to break old habits that are harmful, it's still happening.
Yeah, that's such an important point. So where do you see the field of dental ergonomics heading in the next few years? What advancements or trends should practitioners be aware of?
That's a very interesting question, Cecile. So first of all, I'm hoping that dental ergonomic research and development is taking into account the fact that you've got a human being who can't do just about anything to their body. So when it comes to outer ergonomic items, dentists who are buying equipment need to look for very thin patient chairs so they can get their knees underneath, and ideally flexible sides so they can get their knees on the side as well. Loops are these new ergonomic loops, they are being refined, and in fact a new type has just been released where there are 3 magnifications in one. So I recommend to dentists to start exploring this area, because I believe that European dentists are not as aware as Australian dentists of these refractive loops, which are very helpful in preventing neck bending. And also more and more instruments are designed so that they're ergonomic, so they're not too thin, not too thick to hold. So I'm hoping that there's more and more education in that area. And you probably heard me say this, that there are 2 items that I call an inner and outer ergonomic interface: the stool that the dentist and the dental assistant sit on, and also these loops. The product design needs to take into account biomechanical design, and often they don't. So I'm hopeful that there'll be a better design, because most dental stools are too soft to sit on. And also, as dentists start to sit upright with these refractive loops, what they need is an upright back support, and most dental stools don't have an upright back support. So I'm hoping to see a lot more of that.
Yes. And also the saddle stools, they have a lot of saddle stools. And I don't know how are they good or helpful or not so helpful?
Great question, Cecile. Many dentists absolutely love them. I'm not a fan of them. The sit bones, the ischial tuberosities of the pelvis, are not designed to be on a curved surface. I think a firm seat with high density foam that's flat, and the seat being adjustable just ever so slightly forward sloping with a backrest that's upright is the ideal one as far as I'm concerned. However, the saddle stools are very much loved by many. Unfortunately, they're designed to be quite wide, and for petite women especially, they force the thighs apart, so they're not so comfortable. And also, the other thing I find, Cecile, is that most dental people who are sitting on saddle stools are sitting too high. And when they're sitting too high, their heels are not fully released into the shoe, and then they're not giving the weight of the legs. Each leg weighs at least 12 kilos. They're not giving it onto the floor, and then lower back movement muscles have to activate, which are not designed for lengthy activation. So sitting at the right height, calibrating it just right so they're not too low, not too high, is important.
There's so much to learn. How important is collaboration with local dental associations or educational institutions in advancing the message of optimal dental posture? Are there any partnerships you found particularly fruitful?
I have a good relationship with the Federal Australian Dental Association, and also several of the local, each state in Australia has its own local branch, and I've been invited to present at multiple events, also in New Zealand. So it is important, because that is a way to send out this message and present, because I find that presenting at any dental event that's run by a dental association is a great way to send out a message about this work. Even when dentists don't actually attend an event or don't hear me talk, they see my background and what I do in the program. It is a very good way to get the work known.
And a collaboration with like loop factors or stool design um, companies. Do you have there some collaborations, or do they ask for some advice how they should design the stools in a better way or loops?
Great question. Well, they didn't ask. However, when I discovered over 10 years ago that there was a problem with dental stools, I approached many dental stool manufacturing companies and offered some suggestion. Most of them didn't welcome my feedback. They thought their product was brilliant. However, eventually, one of the Melbourne companies, Australian Dental Engineering, asked me, well, Anikó, how would you design a dental stool? And they've got the Dr. D dental stool that's based on my design. However, I don't have a financial involvement with the company because I don't want dentists to think that I'm recommending a stool because I'm benefiting from it financially. So I want to be neutral and independent of any such involvement. And by now, I'm so well known for this work that several loops companies have approached me about training their team who go out to dentists and measure them up on how to measure up and what it is that is helpful. But that's only in the last few years. Prior to that, I think that was about 6 years ago, 7 years ago, when I discovered that we have a problem with the old-fashioned loops, which is not the refractive loops. Once again, I approached multiple companies who were most unimpressed that I offered them a critique, and I educated many. And eventually, companies are now consulting with me, and also a lot of dentists are approaching me with questions about magnification loops and also any problems.
Yeah, I mean, also the posture is changing while you work on yourself during work and also in daily life. Your posture is changing, and the distance will get probably further away because you are more upright, isn't it? So it needs
So
probably to be measured up after a few years again. Or what do you think about that?
no, not quite. But it is actually a very good question because when dentists are measured up, they don't actually know how to sit upright. And in fact, I've currently trained a few dentists just over the phone who were in pain because they were measured up in this, I'm exaggerating now, but a forced upright, which is not, and then they had a very long working distance and they are in pain because they're using movement muscles. And so I think I need to train the reps who are measuring up dentists for these loops once again to make sure that they're not measuring dentists up that way. Some are also in a forward posture instead of being upright. But once the person who is measuring them up, usually a representative from the loops company, understands how to help them organize themselves, then, or if I teach them how to do that for themselves, then that distance doesn't change too much, and there is a little bit of leeway margin for error. So that is fine. But there are lots of issues. So I often say to dentists or to the reps, get the dentist to just do a little jiggle to make sure they're not pulling up, because they tend to. People think, and I'm sure you've seen this, that they think good posture is this. Well, that's a forced upright.
Yeah, that's true. That's true. So, for those who may not yet be familiar with your work, what resources would you recommend for dentists looking to improve their posture immediately? So, like books, websites, or tools?
Well, for European dentists, the greatest way to improve their working lives and quality of their life and career longevity, of course, is to contact Optimum Dental Posture Switzerland, because I have trained four wonderful Optimum Dental Posture instructors to deliver the programs that I teach and offer in Australia and New Zealand. So that would be my first recommendation. And secondly, on my Facebook page, profile or Optimum Dental Posture page, I have lots and lots of postings where I explain a lot of what I've been talking about, and they're like a mini tutorial. Also, it's available on LinkedIn. I have given a lot of talks, and I am also in the process of organizing to do some online teaching. I don't know any books that can truly offer what we've been talking about. I've been asked to write a book, but I don't know if I ever will. I'm too busy. I like to communicate with people, and I don't think I'm ever going to write a book, but I should say never.
Yes, I would say so. And you are also always evolving. I mean, you are a learner from by heart, and you are really developing your techniques, your thoughts, your work, and refining and working it. And if you have a book, it's just, this state
Yes.
of being, and then it's there. And then you evolve, and probably it's not quite what and you can't change it anymore. So I understand your your way of saying, "Ah, probably not yet, probably later. I hope so. So necessary." Can you share some success stories or testimonials from dental professionals who have implemented your techniques? How have these changes affected their practices?
Well, one of my favorite success stories is a dentist in her, probably late 30s, who was on the verge of shoulder surgery for her dominant arm. And she was told that she has to have surgery, and somehow she reached out to me. I said to her that I can't promise I can save her from having surgery, but in any case, she needs to know what to do and not to do with her shoulder and arm. And as I said, I asked for photos of what people are doing, and I'll exaggerate slightly so you can see she had a habit of lifting her right-handed dentist, lifting her right shoulder and then twisting her arm this way. This is not a common habit, but there are enough dentists doing it. And she had massive problems in her joint. And to my amazement, after teaching her what to do, what not to do, also teaching her how to lie in a restorative way called the active rest. It's a procedure to decompress joints and the spine and release muscle tension. And I taught her a lot in person and online. It was partly during the lockdowns. And she didn't need the surgery. She's able to be back fully practicing dentistry, and she's almost had a personality change because, as we said earlier, when you're in pain, your personality changes. I remember being a lot more irritable. As I said, I lost my sense of humor. So did she. And her partner said that she's a different person, and she looked different. It was almost like, when you see a makeover before and after photo, she
Uh-huh.
just looked radiant because she was not in pain. And for a dentist to think about having to have shoulder surgery on the dominant arm, on the dominant shoulder, is terrifying. So she was very happy and very relieved.
Oh, I can imagine. What a story. And there are so many out there, and some have to stop. And that's
Yes.
that's really terrible that you have to retire before you even worked fully and for a long time. It's not fun. It's if you have
No.
to stop what you love to do. So finally, what message would you like to leave with our audience of dentists and dental assistants and dental hygienists who are eager to implement ergonomic practices into their daily routines? Any tips for getting started on this journey towards better health?
Yes. Well, first of all, I want to offer a message of hope that if you are having any pain and discomfort, there is help out there. And the first thing is to start looking at how you do what you do. If you just start with something as simple as how do you look at your mobile phone? Do you bend down to read your messages? If you can change that habit because the spine below the height of the ears is not designed for that kind of bending, already you will be ahead. And reading about, well, you're welcome to read my posts reach out to Optimum Dental Posture Switzerland if you're in Europe. This is one of the best ways that you can begin to implement good practices. If you're someone who takes your head forward as you look at a screen, coming back over your structure is a very good beginning. If you're in the habit of pulling up thinking that's good posture, just release it, but don't hunch. So these are some of the tips that I can leave you with.
Is there a reason why optimal dental posture trainers are better suited for dentists and this kind of people?
Very good question, Cecile. So any excellent Alexander technique teacher can be helpful and start you off on your journey of learning about your body design and what to do and what not to do. However, unless Alexander teachers like yourself and the other three Optimum Dental Posture trainers who have created and founded Optimum Dental Posture Switzerland, they're not aware of the particular dental challenges. But you're right, any Alexander teacher anywhere in the world is going to be helpful.
Mm-hmm. Thank you so much, Anikó, for sharing your incredible journey with us today and for shedding light on the importance of ergonomics in the dental profession. Your passion for helping fellow dental professionals live healthier and pain-free lives or more pain-free lives is truly inspiring, and we appreciate your commitment to making a difference in this field.
Oh, thank you. It's been a pleasure talking with you, Cecile.
Oh, thank you so much. To our listener, thank you for joining us for this enlightening conversation. We hope you found Dr. Ball's insights valuable and that you feel inspired to take steps towards improving your own work posture and overall well-being. Remember to check out Optimal Dental Posture's website, like Optimal Dental Posture from Anikó and Optimal Dental Posture Switzerland, for more information on workshops and resources available to help enhance your practice. We look forward to having you with us again for our next episode, where we will continue to explore topics that matter not only to dental professionals like you. All the interviews will be available on our YouTube channel. Until next time, take care of yourselves and keep striving for excellence in both your practice and your health.